This is Focus on Your Health on the KJAZ Radio Network. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and on this week's show, we're paying a visit to the Imaging Center. Coming up, we'll hear from Maggie Willis. She's the lead mammography technologist at KRMC. We'll visit with her, and she'll lead us on a walking tour of the Imaging Center. But first, we'll talk with Dr. Christopher Johansen. He's the director of breast imaging at KRMC. Dr. Johansen, we discuss breast health pretty regularly on the show. Can you talk about the importance of catching breast cancer early?
That's amazingly important. The benefit from mammography and just in general from breast exams, anything like that, all comes from the fact that smaller breast cancers are easier to treat, they're cheaper to treat, and we have better success rates. So for instance, if you have a stage 0 breast cancer, something called ductal carcinoma in situ. It's basically the precursor to an invasive breast cancer, and you treat that effectively, you'll have a cure rate that is incredibly high. The life expectancy of that person will be as close to unaffected as any doctor will ever say. Unfortunately, if you have a stage 4 breast cancer, a cancer that's already starting to spread outside of the axilla, the armpits, and the breast, that cure rate drops essentially to 0. Wow. At that point, you can use all sorts of really intense techniques like chemotherapy to fight a rear guard battle. And then everything in between those two falls somewhere in the middle. You have to use some of these advanced techniques. It takes longer to fight, and we don't do quite as well. So the earlier that you can find breast cancer, the better off you are in basically every way we can measure.
Right.
Mammography's big advantage is that it can find things when they're particularly small, before you can feel them on exam, before you can see a difference in the breast. It can find things that are very amenable to treatment.
And you never go to bed one night and wake up the next morning suddenly with stage 4 cancer. You know, this is something, what I'm saying is if you're taking care of your yearly mammograms.
Well, I won't say, no doctor will ever say never. Mammography will catch about 90% of breast cancers.
Okay.
There are unfortunately a few very, very difficult to see breast cancers that can remain occult. They can remain not seen on mammography. 90% is pretty darn good. There are other techniques that we can add, especially in cases where we know a woman is at very high risk, like breast MRI, that will increase that sensitivity and allow us to catch the vast majority of those remaining few cancers that evade our detection on mammography. Some cancers will grow much faster than others. You'll not go to sleep one night with no cancer and wake up with stage 4, but some cancers can go very quickly. They can go from a point where literally the first physical symptom is a stage 4 breast cancer.
Wow.
It's unusual to have someone who's being screened yearly with mammography get to that point, but not impossible. Right. It's important that we don't oversell mammography. It's an incredibly useful technique, but it's not a silver bullet that will catch every breast cancer and eliminate morbidity and mortality from breast cancer. But it is, without a doubt, the best tool we have and the most effective tool we have to make sure that as many women survive breast cancer as possible.
It seems safe to say, at least, with regular mammograms, with knowing your risk in terms of your biological, genealogical history, with being aware of what's going on with your body, and of course, health, exercise, right?
Right.
If you do these things, you can certainly slant the odds in your favor.
Absolutely. For the typical woman who doesn't have some sort of unusual genetic syndrome or incredibly strong family history, the absolute best thing you can do to avoid dying from breast cancer is get a yearly mammogram.
Hi, Maggie Willis.
Hi, TG.
You are the lead mammography technologist here.
Yes, I am.
What does that mean?
Well, that means I'm in charge.
Okay. That means you're in charge of this little tour for me. Will you show me around a little bit?
Absolutely. So we're going down the hall here, and our patients consist of X-ray, MRI, CT, nuclear medicine, mammography, DEXA, and ultrasound. We see quite a bit of patients every day, and they they come into this outpatient center, which is very nice because it's very different than going to the hospital setting. It's very relaxing, very sedate, and patients tend to like this kind of setting for their patient care. So we kind of just walk them back and we greet them in the front lobby, and then we introduce ourselves and let them know how long of a time it's involved with their exam and what we do for them, and kind of explain in a brief moment so in a language they can understand what we're trying to do and help them with. So that's our daily routines here, and I'm in charge of mammography. I do mammograms, and I'm in charge of the flow, making sure everybody's on time. That's important, and making sure our ladies are being taken care of. We do see some men, male patients, once in a while. Men do get some disease with the breast, one in general, but overall we have a lot of volumes in female patients. So that's pretty much what I do.
When a woman comes in for a mammogram, what is that process like?
Well, that involves with patient getting a reminder call the day before. We remind them of their appointment time and date, and we introduce ourselves to them so they kind of get themselves prepared. You know, someone on the other side of the phone that they're talking to will be the technologist for that day. That gives them a good relational background right away. So when they come in and they are being greeted friendly by our front desk receptionist, then they automatically become very relaxed, knowing that they're in good hands. And then the receptionist basically check on their information, demographics information, and insurance and all that. And that only takes a brief 3 to 4 minutes time. And then patients are told to have a seat while the technologist is getting their room ready back there. And then the technologists come out to the main lobby and greet them and take them back to individual modality areas. So the mammo ladies will be coming back to the mammo area, and we take them to a dressing room area, and that's where they prepare themselves for the exam. They're going to take their clothing off and whatnot and put on a gown and so on and so on, and then we take them to the exam room and do the exam.
I came in once for an interview, and one thing that struck me was I was sort of the lone man on the floor, and they said, okay, make sure wait, just stop here. We're going to go around the corner. We're going to make sure everything's all clear before you proceed. And it was clear to me that privacy is so important here.
Yes, absolutely. We really honor that, because most women, when they're in a gown, they feel like they're being exposed to the world already. So having the opposite sex in the room, that tends to make them a little nervous. And I'm just the opposite. No, just kidding.
Oh, Maggie.
Edit. But yeah, I think due to the courtesy for most of our patients, we adopted that policy in our facility.
You have a lot of really fantastic technology here in this building. Will you show me a little bit of it?
Absolutely. We can start with ultrasound rooms that we're standing in front of. We have 3 ultrasound examination rooms, and of course we have 3 technologists. And each day we perform different kinds of ultrasound for our patients. They can range from breast as well as abdomen and kidneys and lower leg extremities and whatnot, and cardiac studies. And then we go around the corner into the main hallway, and we're facing 2 rooms. One on the left is mammography room. We call it mammogram room 1, and that's where we do most of our procedures in mammography. We do both screening mammograms as well as diagnostic mammograms. And a lot of people ask what the question is, what the difference is. Well, the difference is that basically, screening mammogram is with a patient with no symptoms whatsoever. She's not experiencing any lumps and bumps, no pain when she comes in. And obviously, the diagnostic mammogram is for the lumps and bumps she felt. Or we can call the diagnostic mammogram for patients who are following up from the previous mammogram. If she had an abnormal mammogram, let's say a month ago, or 6 months ago, or 3 months ago, we're following her up, and that's qualified as diagnostic mammograms. And then we're going out this room toward the left, and this room is called stereotactic biopsy room. And as the word says, it's basically a procedure room. And this is the room we perform biopsies of the breast. And basically we're looking at a state-of-the-art machine made by Hologic, and it's called the multi-care platform machine. It's a prone machine, which means patients facing down and patients laying down on her stomach, and with the breast tissue droop through the hole and so on. So it's a very comfortable, non-intimidating position for most female patients. So we do this quite a bit, average anywhere between 2 exams to 4 exams per week. So that's a good volume for us.
It's break time on Focus on Your Health. We'll be back for more with Maggie Willis in just a moment. This is the KJazz Radio Network.
Hoy vuelvo a la frontera, otra vez he de atravesar. Es el viento que me manda, que me empuja a la frontera y que borra
And welcome back to Focus on Your Health here on the KJazz Radio Network. This week we're visiting with Maggie Willis. She's the lead mammography technologist at KRMC, and she's leading us on a walking tour of the imaging center.
On my left, again, it's called the dressing room. This is the place we bring patients back here and getting them dressed, and they're in a very private corner, and they're getting dressed, and we also have lockers on the other side of the wall, as you can see. That gives our ladies or patients convenience of storing their personal belongings in a very secured, safe place. And then our patients are being guided over on this side, which is the opposite side of the lockers, which is what we call it, a little waiting area with a TV. And basically this is where they can just sit down, relax while they're being waiting for the exam, or before they're being talked to by a radiologist and whatnot, or nurse navigator, we have it, patient navigator, Jennifer. So this is where most of our patients wait, in the mammography unit.
So I did an interview before with Jennifer, and I know she's right down the hall, and sometimes a patient will come out with some bad news, with a lot of plans ahead, and Jennifer is wonderful, and I think her role here is really to help those patients to understand what comes next and help them through the process, right?
Correct, absolutely. Her position is called patient care navigator. A lot of facilities don't have that luxury of having that position in the mammography department. However, Kingman Regional Medical Center is fortunate enough to create that position for our community, which is a great asset. And with that position, our patients feel like there is a fluid transition from being diagnosed to treatment. That's very important, because during that time, it's very scary for them for the reasons such as diagnosis being, effective to their emotional and physical changes. So there's a lot of unknowns to our patients, and patient care navigator is the person to be there for the patient, going through all kinds of phases and experience their emotions and explain to them the next step and what's going to happen to them, and set them at ease and answer all kinds of questions and provide all kinds of resources for them. And we are very, very fortunate in Kingman Regional Medical Center to have that for our communities. I want to stress that.
You've done this kind of thing before, huh?
Well, no, I haven't.
Come on.
No, I've been doing this for quite some time already. I won't date myself, but I feel very fortunate to be involved in this community and provide best patient care for our patients. So as we're walking down to another hallway, by the way, the hallways here are all nicely curved corners, and which makes traveling a lot easier for our patients. So people don't easily bump into the corners and break their skin. That's the part I like because I tend to walk in the walls quite a bit. Okay, so as we're walking down all the way to the end of the hall, we're seeing we have an MRI machine that is, again, another high-tech machine that we offer at Kingman Regional Medical Center, Imaging Center. And we do quite a bit of MRIs every day. And patients love coming here to get their MRIs done because, again, it's an outpatient setting. It's very non-threatening. They come and just feel like they take a walk in the park sort of feeling. So it's a great convenient for most of our patients coming here and getting their MRI, get on the table, and we do the exam within 45 to an hour sometimes, or sometimes it goes in 2 hours depending on the amount of exams. So we do this every single day, and our patients love it.
Now this says MRI control room. I'd like to get a look inside. Is that possible?
Yes, of course. We can go through this door.
Now, it says strong magnetic field, so I don't know, perhaps this microphone will evaporate when we walk in. Let's find out what happens.
So we can walk in with any medals we have on us. It's totally safe. As you can see, we're facing a glass door. So behind the glass door, that's where the magnet and the gantry is. And obviously that's where zone 1 is. And that gantry and magnet is on all the time. So for you and I to walk in there now with medals and keys in our pockets, that's going to be a big no-no. So that's why we have it labeled. For now, we're looking at a workstation. That's where the technologist, MRI technologist sits. He or she sits in front and will look at some monitors. And he or she can also look through a glass window, tinted, to look at the gantry and the patient, of course, if there's one. And they can watch the patient exactly. They speak to the patient through the microphone on this workstation.
This is incredible. I've never actually seen this sort of machinery. I don't know how to describe it exactly. You probably can provide the better technical terms for me.
Well, for those who watched Star Trek back in the 60s, they can definitely relate to it. It's gigantically magical. The machine is a big, giant magnet, and it does certain things to our body, and certain compound in our body attracts the magnet to line it up so that it compose itself to become certain signals, and the signals being picked up electronically, computer processing, whatnot, and it becomes information medically needed for the radiologist doctors to interpret. And so that's how certain diseases can be detected through MRI exams, and it's top things these days. Everybody talks about having their MRIs done. It's almost like getting a big Purple Heart or something. Yeah.
It's really such an impressive facility.
Yes. Again, this is the top of the line, and we just had the most recent upgrade, computer upgrade. Even though you're looking at a machine, that doesn't mean it has the most recent upgrade. So whenever you go to a facility, you want to ask them what kind of version upgrade do they have, and that's how you learn they have the newest and the latest. We also have CT's department, or a suite. As we walk down from the MRI, not too far, about 10 feet or so, we're looking at a room with a CAT scan control, and a lot of people think it's literally a cat in it being scanned, but that's a funny way of remembering things, I suppose. So as you and I walk through here, we're looking at two rooms. One to our right, and that will be our CT gantry room. And then the one to your left, it's a PET scan gantry room. And the difference between the two is quite a bit, but they're being used conjunctionally to work together. So CT, as most people are aware, CT has been around for quite some time, and CT is great for diagnosing a lot of diseases. Patient comes in for anything between head trauma to lower back pain to abdominal problems, whatnot, and so CT can pick those up really, really good. And then PET scan, it works with CT. It kind of maps the body from head to toes, and then it picks up the hot spots in our body, and that's usually for therapeutic purpose, such as radiation and oncology-related area, disease treating. So that's PET scan. So you got a cat and you got a pet.
I could see why that might be confusing.
Yes, indeed. So as we walk through here, and we're going back to the X-ray, and again we have X-ray. We have one X-ray room. We do most X-rays from head to toes every day, so a patient can have a terrible cough for the last 3 weeks or so. That's what we do, chest X-ray. Our patient fell last week snowboarding, hurting the ankle or foot, and then we do the X-rays in those areas. So, and the other side X-ray, in fact, around the same corner, we have a machine called bone density, or DEXA, D-E-X-A. And this machine, it picks up the density in our body, certain parts of our body, that demonstrates the mineral density in our body that accumulates, and if we are prone to the disease called osteoporosis or not. So again, it's a table, patient lay down flat, facing up. The machine just kind of takes over. It doesn't do anything, does not touch the patient whatsoever. There's no pressure. Basically, it's a very relaxing exam. Patient's on the table, anywhere between 5 to 10 minutes, and done with the exam and walk out just fine. And then it's a great way, it's an accurate way to detect for osteoporosis. It's called DEXA scan.
You know, there's a sort of a quiet hum in the room, and then there's this faint kind of purple glow about the place, which is as in every X-ray facility I've ever been in. And I have to say, for me, it brings back memories. I was a little kid with asthma, and I was always going off to get X-rays of my lungs, and I had, pneumonia and asthmatic bronchitis, and I haven't really had too many X-rays, the occasional broken bone, but I haven't had too many X-rays since then, and now I'm coming in here, and I'm like, wow.
Memories coming back.
For sure, yeah.
Yeah, it's amazing how certain colors and the ambience of a room can, bring our certain memories back in some ways. But overall, the design of this whole building is very serene, like you said. It calms you down, and obviously it's built in a great constructive way. And I understand there was a wonderful, famous architect that designed this building. I didn't quite get his name, but I'm sure that he's very famous.
This is a new facility as well, right? It's just a few years old?
I believe it was built anywhere, 2010 to 2011. Yeah. So anyhow, that's the whole building, imaging center.
That's Maggie Willis, lead mammography technologist at KRMC. Maggie, this was fun and interesting. Thanks for being with us.
Well, it's a piece of cake.
And for more information on the Imaging Center, or to schedule an appointment, you can call 928-692-2727. That's 692-2727. And that's this week's show. I'm T.G. LaFredo. Thanks for listening. And please join me again next Saturday at 11:30 a.m. for another edition of Focus on Your Health, right here on the KJazz Radio Network.